Good afternoon and welcome to our Focus on Facebook Live. My name is Hasneen Kermali, the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we like to highlight one of the clinical departments here at the hospital and wanted to bring you some new insights about the expert providers that we're able to present to the community. We wanted to do something a little bit different today, this month, particularly given it's a new year. And we're starting the new year off with a bang, and I'd like to welcome to our table today the president of St. Mary's Hospital, Kim Kalajainen. Welcome, Kim, and welcome to the program. So taking some time out of your busy schedule, brand new year, I thought it was a good opportunity to do a year in review and a sort of an outlook for what we can look forward to, where we stand today and what we can look forward to for the future. So let's look with a, sort of a general overview of what a hospital president does. As Chief Medical Officer, sort of my role is the medical and clinical side of operations. We've had our Chief Nursing Officer, Shauna Edwards, come on, talk some about the initiatives in the nursing side. But what about the president of a hospital? What does a president of a hospital do? Give us your role.
Yeah, so I have to say that I think the role here at St. Mary's and probably for Trinity Health of New England is a little bit different than some other hospitals. And so it's, I think, good to talk about it. You and I worked together for 2 years side by side.
Yes. As
peers, because I was the Vice President of Operations here at St. Mary's starting in 2019. The summer of 2019, and the role just kind of evolved. So as Vice President of Operations, I worked beside you and Shauna as we worked on clinical things. I had the ancillaries, the lab, radiology, cardiology, a lot of the outpatient services, and with this kind of expanded role into the President, I still have all of that. I still work with our support service leaders on our facilities and our environmental services. But the president role has given me the opportunity to kind of broaden some of the things that I'm involved in. One of the ones that I'm really excited about is when I get to represent St. Mary's to our regional leadership team. Mm-hmm. And some of that is strategy, which is a lot of fun, I have to say, thinking about St. Mary's future and the direction that we can chart for ourselves here.
Yeah.
Some of it is advocating for what St. Mary's needs,
yeah,
which I take very seriously, and sometimes I think they might be tired of hearing from me at the regional level, but it's a big part of the role that I feel I need to take on. And then I think there's another element, because St. Mary's is part of the New England region of Trinity Health, which is a national healthcare provider. A lot of times we're just looking to align and standardize our operations as a best practice. And so there's a fair amount of work there. And then locally, the parts that I love is working with you and the medical staff.
Yeah.
Because I think we have such an outstanding medical staff here. I get to have a lot of fun representing St. Mary's within the community on various boards and events that take place in the community. And we also have 2 boards here, boards of directors at St. Mary's, one specific to the hospital and the other one to our foundation.
Yeah.
So I love working with our directors that are guiding and overseeing this organization from that point of view. So it is an expanded role, it's a blended role, and I've really enjoyed my time so far.
And it still sounds like you're still involved in the day-to-day happenings here at St. Mary's. I mean, we talked about the lab, we talked about cardiology, we talked about facilities. So how the hospital continues to click like clockwork, you're still involved very deeply in that.
I am, and I still think of it as our three-legged stool of you as our top physician, leading the way for us with our medical staff and our medical operations, and Shauna being that second leg, and I'm the third leg. nursing, and then I have kind of the operations and the business part. And what's great about our three-legged stool is we get wrapped around with support from mission,
Yeah.
from human resources, and from finance. And I think, we make a great team.
We make a great team. So let's talk about what the team has been able to accomplish in 2023, some of the achievements. We've had some goals and standards that we set for ourselves. Tell us about those.
Yeah, so the first thing I want to talk about is a lot of the work that you and Shauna have been so instrumental in leading here at the hospital. And it really all starts with the safety of our patients and the quality of care that our patients receive. And what we've done over the past year, I just find remarkable. At St. Mary's, where we have received a grade A, the highest grade you can receive from Leapfrog, which is an independent reviewer of safety and quality information.
Yeah.
And they publish their grades twice a year. And in 2023, we were A's in both grading periods.
High honors.
High honors, can't get any better than that. And it's really a testament, I think, to everyone that works here at St. Mary's and to our medical staff that we've been able to come together and really understand what we need to do to keep our patients safe and what we need to do to ensure that they receive quality of care.
And it's a focus on patients.
It is.
Yeah.
And then, it is worth noting that there are other accomplishments around our accreditation or our regulatory pieces. So in 2023, we had the Joint Commission visit us. They visit us once every 3 years. And we had a very successful review, passed with flying colors. And then there's been a lot of clinical work on our programs with Joint Commission. And you know this better than I do, but last I counted, we have primary stroke accreditation, spine surgery, orthopedic trauma, hip fracture. I mean, it's pretty amazing what we've been able to do with those strong clinical programs and getting accreditation from the Joint Commission.
And when we talk about those things, I think it's just, again, providing that high quality, high safety focus on patients so that they get that high degree caliber care right here in their backyard. And that's, I think, just what we want to continue to provide all the way around. Requires a big team effort. And so I'm glad that we were able to accomplish some, and I think that's just the beginning. So keep going. There's more.
There is more.
There is more.
So for sure. So, we talked about patient safety, but another big focus for us, and again, you and Shauna have been instrumental in leading the way here, is with our colleagues' safety. Because one thing that we want is for anyone that works here at St. Mary's, for them to feel safe in the environment and to make sure that they have everything they need to do their job safely.
Yeah.
And so we've had a significant reduction, which is a positive, a significant reduction in our colleagues' injuries while at work. And that's just been amazing, and I'm so proud to say that we're able to keep our colleagues safer here at St. Mary's.
Yeah, yeah. I mean, it's crucial for our patients to know that part of the quality of care that they get is the team that supports them. Mm-hmm. And that team support is all of us that support each other. Yeah. And we do that in such a great, caring manner. And it really creates that family environment. And the family knows that, we've got each other's backs. And that's huge when we come to work. We spend so much time here away from our own families. And St. Mary's, I think, we love to say it's its own family. And we really believe that. And I think we feel that when we walk through the halls. Everybody's got each other's backs. And the colleagues say that, and we hear that all the time. Love that. And
so I think foundationally, our building blocks are keeping our patients safe and keeping our colleagues safe.
Yes.
And once we have that well under control, which we do, that next set of building blocks is making sure our patients have a very positive experience with us and making sure that our colleagues are really engaged and enjoying their experience working here at St. Mary's. And so in 2023, we've had some really good work that occurred in those two areas. The biggest for St. Mary's was we moved to a patient feedback system called Net Promoter Score.
Mm-hmm.
And a lot of industries, different industries use it, and healthcare is adopting it. And the grade range is from a negative 100 to a positive 100.
Yes.
So basically 200 points out there in the stratosphere. And if you have 50 points, positive 50, that means you're doing excellent work in whatever industry you're in. And I'm really proud to say that our inpatient care is beyond that 50-point scale of excellent.
Yeah.
And we are on our way to approaching world class. And again, it's a testament to all of our colleagues providing the care, our physicians providing the care, our support services, because not only are we providing the care, we're providing an experience to the patients that they view as positive. And so that's really important. And I would say in 2023, we've put in a lot of processes in place where we can listen to our colleagues better and take action on their feedback. And so that was another big improvement that I saw in 2023, where we have formal mechanisms like surveys where we're gathering feedback from our colleagues, but we're also rounding and just talking and listening. And that's very important.
And I love the idea that, you know, you especially are listening. And I think that's the feedback that I keep hearing is Kim's available to listen. And not only does she listen, she hears what we're saying, because the feedback comes all the way back around. Mm-hmm. So it's that open listening, hearing. You keep your hearing ears on. And that just provides this new era where, and we see it, you know, people remark, we saw Kim pushing a wheelchair of a patient down the hallway, and then they remark, we've never seen the president of our hospital do that, and there you were doing that. And it's just remarkable. It's that you're out there listening, hearing, providing that closed loop communication, which is fantastic.
Yeah, well, it's really my honor to do that. So the last thing I want to say about 2023 is, you know, we have those foundational building blocks, and we're doing great work, and it translated into financial results and financial success for St. Mary's, which I think in a climate and in an industry where so many hospitals are encountering financial hardship, it should make all of us at St. Mary's and the greater Waterbury community feel really good about what's happening at St. Mary's and the fact that we are in the black, we have a positive operating margin, and we're, you know, exceeding the expectations that Trinity Health has for us financially. And it's hard work, but it's good work, and we've accomplished the financial results that we've needed to.
And in today's climate, when we look at, and you're right, the media is talking about this day in and day out. We're hearing about this across the board, not just here in Connecticut, in neighboring states as well. It's a problem. And hospitals are struggling out there from a number of perspectives, insurances and reimbursement, and that's a challenge in the business of healthcare. And yet here we are promoting the right steps, I think, between patient care, patient quality, colleague care, colleague safety, and it creates an environment which allows us to, if our focus is on the right things, the results will speak for themselves. Is at least something that I believe in strongly, so that we don't have to focus on the financials as our primary.
That's right. We
focus on the right things as our primary, and the financials become the result of that.
So true.
So that's wonderful. So what does the future look like? What are our updates? What are we looking for the future? I'm excited. I'm excited.
So I'm excited too. So 2024, I know from a calendar standpoint, today completes our first month.
First month.
But for us at St. Mary's, our fiscal year, our financial year starts in July.
Yes.
So what I'm very proud to say today is that for this current fiscal year that we're in, everything that we accomplished in 2023 is still holding true in 2024. Our patient experience is strong, our patient safety is strong, we're protecting our colleagues in the workplace. Hopefully they're reaping the benefits of us improving the environment that they work in. So it's all of that plus more. And the plus more, which I'm really excited about, right at the end of 2023, we did our first renovation in the emergency department.
Yeah.
It's been a long time coming, but we really re-engineered how patients come into the emergency department, how they're greeted, how they're registered, and that whole kind of front-end experience. We have an expanded waiting area. We're hoping no one's waiting too long, but we have more volume, so we needed to plan for a larger waiting area, and we've accomplished all that. So in 2024, we're now going to move inside the emergency department and really improve the work environment to make it more efficient and effective for our physicians and all of our colleagues that work in the ED. So that is a big focus for us in 2024. We also have a new location that will open up in Watertown, which we're really excited about. And that will be a relocation of our primary care practice that's on Hemingway in Watertown. We are going to relocate an OBGYN practice that's led by Dr. Albini and his team. So they're going to have a presence in Watertown. We're going to offer laboratory services, x-ray services, outpatient rehab services. So it'll be a comprehensive location for care, and we're really excited about that. And then I think the biggest thing that I see happening in 2024 is our continued growth in our services. And I just wanted to throw out some numbers because I think those are cool things to do.
You are a math major.
Yes,
you are a numbers person.
I was a math major. So we now have 3 surgical robots here at St. Mary's.
3 surgical robots for a community hospital.
Yes, pretty impressive.
That is impressive. That is impressive.
And it's being used. But right now we're in the midst of constructing, expanding one of our operating rooms so that it will have a final home. So we're excited about that, and love all of the surgeons in the community being able to come in and use that robot. I also wanted to talk about our deliveries, our babies that are being born here at St. Mary's. Last year we did 621 births. Right now we're looking at about a 10% growth rate if we continue to track as we have been for the first 7 months, and we're going to end up very close to 700 births.
That's excellent.
So pretty big growth rate in a geography and a population that is aging. You would think that births would be declining, but here at St. Mary's, babies are us.
Babies are us.
About that.
Well, I mean, it's great to see that we continue to be a trusted partner for families all the way around.
Yeah, and cardiology is another one that. So last fiscal year, we experienced a 17% growth. We did over 900 cardiac catheterizations here at St. Mary's.
Really?
Yes, we did.
Oh my goodness.
And this year we've added another interventional cardiologist. So now we have Dr. Al-Huck and we have Dr. Thorpe, and we're looking at about a 3% growth this year in that volume. So we're going strong.
And that's interesting, because we were hearing from our board members just the other day that they were hearing from some community members that St. Mary's does not offer cardiology services. But I think it's important for us to let our community know that not only do we offer cardiology services, that we've got interventional cardiologists that are present here. So if patients are having chest pain, our cardiology program comes in, their EKG is done in the field, our emergency room receives that EKG, that's part of the program. They're able to activate the cath lab right away. Our interventionalists will see them here, they'll get the care that they need. If they need cardiac surgery emergently, we have the cardiac surgeon who's going to see them right here at the hospital.
That's right.
They're going to get their cardiac surgery right here. If they need emergent surgery and it is very, very complex, we have the expertise to be able to manage that in an appropriate way within our system.
Yes.
So they're going to be able to understand their team is going to be the same all the way around. And that's very important. So they're not going to get a brand new surgeon that they've never seen before at a different area. It's going to be the same team that's going to be taking care of them.
Right.
And that's going to be amazing because then their follow-up, they're going to be able to have the same follow-up in their same town. It's going to be their same cardiologist all the way around.
That's right.
And that growth continues. So
Yes.
let the secret be told. St. Mary's continues to offer cardiology care.
Yes.
And our cardiologists are readily available to see patients across the board.
They are. And then I think the last thing I wanted to talk about is to circle back to our emergency department. I had mentioned that we had done some renovations and that we're going to continue to renovate our emergency department. But for those that may not know, St. Mary's sees the majority of emergency department patients in this community. Last year alone, we had over 58,000 visits to our emergency department, and that was 4% growth last year.
Yeah.
This year, we're going to be very close or perhaps surpass 60,000 visits, and again, about a 3% growth rate is what we're looking at there. So the volume is great, but the thing that I'd really like the community to know is the work that our physicians and our colleagues in the ED have been doing around the patient experience.
Yeah.
I had mentioned Net Promoter Score around our inpatient nursing before. And so our scores in our emergency department are what Net Promoter would say is favorable. That's not where we want to be. That's not where
Correct.
we want to end up. But it is a favorable experience right now. And in the past 2 months, November and December, we had improved our score. We doubled our score in Net Promoter.
Yeah.
So we are on an upward trend with how we're providing the patient experience and the care in the ED, and I'm hoping that the community knows that we are here for them and that we are working very hard to give them an outstanding emergency department experience when they need it.
And we've got some very young, vibrant leaders.
We do.
Dr. Bergwart, who's our chair of the emergency department, Arlo Wishenko, who's our nursing, currently interim director, who's leading the way on the nursing side. I think they're a great duo who are working together to really have a vision of true partnership on how to navigate patients as they work through. I know we talk to them often. Really a vision on how to take care of patients as they walk through the door. That the emergency room isn't just once they get inside. It's really the whole process and incorporating, it's not just the waiting room outside. Patients need to get seen even if they're outside. That stub toe shouldn't have to wait 3 hours to get seen. And we're working on a whole process. And it starts with that, that new desk that we have out there, but that's just part of the process. It's not just new paint, but there's a whole process that they've redeveloped.
Right.
And we've got some work to do, we admit that, but they are continuing to look at that to get that on par so that we could deliver that world-class care.
Yeah. So all of that in 24 and likely more.
So one thing you mentioned, and I want to go back to this, St. Mary's role in the community. What's our mission? Mission is very important to me. Mission is very important to you, very important to St. Mary's Hospital. How are we doing with our mission in the community, St. Mary's Hospital?
Yeah, so I had a feeling you were going to ask me that question. And, St. Mary's was founded over 100 years ago by the Sisters of Providence, and they were all mission.
Yes.
And fast forward 100 plus years, you and I are sitting here, and I am really pleased because I still see that mission being carried out here at St. Mary's on a daily basis. we may not have nuns walking the hall. We may not have nuns serving as the president anymore. But what we do have is a very dynamic mission leader in Stephanie Bacuzzi.
Yes.
And she is touching all levels here at St. Mary's and really bringing that mission to life. And I'm also really pleased to announce, specific to the community, because our mission is to be that healing and transforming presence in the community. I'm very energized about our new community health and well-being manager, Cheryl Hilton, who joined us at the end of November. She's getting oriented and getting her legs under her, but she really, I think, has a firm grasp on this community and is going to be instrumental in moving us forward. And really looking forward to partnering with Bridge to Success, which is an organization that Trinity has selected to help us with our Transforming Communities grant, which is a grant of about $300,000 that Trinity Health, our parent corporation, has given us here at St. Mary's to work in the community with.
Wow.
And so we're looking forward to that. And last but not least, we did decide for our community health improvement plan for the coming 2 years to focus on behavioral health. And so those are all good things, and I'm very excited to see the work that will continue to be done and get amplified in the community.
So it sounds like we are on a great path with regards to our mission in the community. It sounded like we've got some great finance steps that we are continuing to take in a positive growth momentum.
Yeah.
However, and I can't just lob easy softballs to you, Kim. It's going to be baseball time soon, and the weather's going to become spring soon enough.
Curveball.
Spring season's going to start soon enough. Challenges that healthcare is dealing with.
Yeah.
And I think some average people may not always be aware of this. When we talk about the emergency room, I think that sometimes weighs on people's minds. Often in the media we hear about hospitals losing money. We've talked about that. And I think here at St. Mary's we've overcome that issue because we've put into place, like we've talked about, solutions to that. What about staffing shortages? Yeah. Can you speak to some of those headlines? Maybe share to our viewers some of those challenges that we face. How are we managing those things?
Sure. So I would say running a hospital, whether it's St. Mary's or any other hospital right now, it's like running your household at home.
Yeah.
In many, many ways. All of the cost of goods, all of our supply cost for everything that we need here at St. Mary's, those costs are increasing. Just like at home, everyone's food costs are increasing. Utility costs are increasing. So everyone understands, I think, the economics of all of your cost going up. And to your point, a big part of our cost, probably around 33% of our cost at St. Mary's, is the cost of our labor for all of our colleagues. And the one thing I will say that's a little bit different for St. Mary's this year in 24 versus 23 is we have been able to attract more people to come work here at St. Mary's. Now trust me, it doesn't mean that we don't have any openings.
Yeah.
We heard earlier this week we have over 200 open positions at St. Mary's, so we're still recruiting.
Sure.
But we're in a better place than we were last year. We're spending less money on what we call contract labor, where we have to bring people in from outside the community, outside of the state, to come work here. So that's helping us lower our cost. And really I attribute that to our colleagues here are creating the environment where more people want to come work.
Yeah. Right?
So as long as we create that good environment and we're able to keep our costs low, we don't have to rely on contract labor, it's going to continue to allow us to have a positive financial outcome. which allows us to continue to invest in the community, continue to invest in new technology, and continue to do our very best to ensure we're offering competitive wages to our colleagues.
I mean, that's all very, very positive. It clearly still shows we are in a position that we have opportunities that we're going to have to go after. One thing that we always do, however, is we ask our guests to provide one nugget to our viewers before they leave. So one pearl to leave with our audience before you go, Kim, regarding healthcare.
Oh my goodness. I guess for me, what I've learned in my time here at St. Mary's is that I am grateful to work here. I am grateful to serve here. And what I can tell everyone, one nugget about St. Mary's is that there is a relentless pursuit to get better and to drive towards excellence in all that we do. And so I would say take that to the bank, that our team here at St. Mary's is going to continue to push forward to be as excellent as we can be.
Wonderful. Thank you all for joining us, and thank you, Kim, for joining us. And we will see you next time on our Focus on Facebook.